BPC 157, a synthetic peptide derived from gastric juice, is revolutionizing recovery for athletes and those with chronic injuries. It accelerates healing by promoting tissue repair and reducing inflammation. This peptide is gaining traction in the biohacking community for its potential to halve recovery time, offering a promising solution for optimizing healing processes. Peptides, short chains of amino acids, are crucial for biological processes like hormone production and tissue repair. Their small size enhances absorption and targeted action, making them effective for therapeutic applications. Naturally occurring peptides regulate growth and immune response, while their bioavailability allows precise effects with minimal side effects. BPC 157, a synthetic peptide, originates from a gastric protein fragment. Comprising 15 amino acids, it is engineered for enhanced stability and therapeutic potential. Unlike its natural counterpart, BPC 157 functions body-wide, not just in the digestive system, offering cytoprotective benefits by shielding cells from damage during healing. BPC 157's healing properties are rooted in its ability to modulate growth hormone receptors, enhancing local growth factor activity. It promotes angiogenesis, forming new blood vessels to supply nutrients and oxygen to damaged tissues. Additionally, BPC 157 accelerates fibroblast migration, crucial for tissue regeneration, by enhancing the production of healing components. BPC 157 excels in healing tissues with prolonged recovery times. It promotes tendon and ligament repair, potentially reducing recovery by weeks. In muscle recovery, it accelerates repair and reduces scar tissue. For gut lining restoration, it regenerates intestinal mucosa, aiding conditions like leaky gut. Additionally, it enhances joint stability by improving supportive tissue integrity. Animal studies on BPC 157 reveal accelerated tendon recovery, enhanced muscle regeneration, and rapid gut healing. These findings suggest potential therapeutic applications despite limited human trials. Notably, Achilles tendon recovery in rats was 30 to 40% faster, muscle injuries showed reduced scar formation, and intestinal lesions healed rapidly, indicating benefits for conditions like inflammatory bowel disease and leaky gut. Choosing the right BPC 157 administration method is crucial. Subcutaneous injections offer high systemic absorption and are less painful, ideal for general healing. Intramuscular injections provide faster absorption, targeting muscle injuries but require precision. Oral administration is convenient, effective for gut issues, but has lower bioavailability, necessitating higher doses. Each method impacts results and user experience differently. Establishing an effective BPC 157 dosing protocol involves balancing dosage, frequency, and duration. Standard protocols suggest a 4-8-week course with daily administration of 250-500 micrograms. Acute injuries may benefit from higher initial doses, while chronic conditions respond to consistent lower dosing. Avoid exceeding 8 weeks to prevent receptor desensitization. Implementing a structured BPC 157 protocol for my rotator cuff injury led to significant improvements. By day 7, pain reduced by 20% and stiffness lessened. By day 14, pain decreased by 50%, allowing light exercises. By day 21, pain was down 70%, enabling moderate training. By day 30, pain reduced over 85%, restoring full motion and faster recovery. Establishing objective metrics is crucial for tracking BPC 157 progress. Document baseline measurements like range of motion and pain scale before starting. Implement a regular assessment schedule, performing consistent tests every 3 to 4 days. Document functional improvements, noting capacity and discomfort. This data-driven approach optimizes your protocol and provides valuable reference for future healing strategies. BPC 157 is not only for recovery but also enhances performance in healthy individuals. Athletes using BPC 157 report a 42% faster recovery, allowing increased training volume by 35% without added injury risk. Additionally, there's a 28% strength gain in previously injured areas, making it invaluable for competitive athletes seeking performance enhancement. Combining BPC 157 with synergistic compounds can enhance recovery. TB500 aids severe tendon injuries, GHKQ boosts collagen and skin healing, pentosan polysulfate improves joint health, and collagen supplements provide essential building blocks. These combinations target multiple pathways, potentially accelerating healing beyond individual treatments tailored to specific injuries and goals. BPC 157's regulatory gray area demands careful safety considerations. Its unregulated status requires users to ensure source quality and consult healthcare providers. Purchase from reputable suppliers with testing documentation, use sterile preparation techniques, and monitor for benefits and adverse reactions. This approach balances self-directed healing with the responsibility of informed use. BPC 157's regulatory status is complex, varying by country. In the United States, it's a research chemical, legally purchasable but not for human consumption. This creates a loophole for biohackers. The lack of oversight means users must ensure quality and safety themselves, as regulations and product standards differ internationally. BPC 157 is generally safe, but users should be aware of potential side effects like injection site reactions, mild gastrointestinal discomfort, headaches, and blood pressure changes. Starting with lower doses helps assess sensitivity and minimize risks. Severe or persistent symptoms should prompt discontinuation and medical advice. The peptide market's lack of regulation leads to quality disparities among suppliers. Counterfeit or impure BPC 157 can pose health risks. Reliable sources are crucial for safe use. Reputable suppliers conduct rigorous testing and provide verification. Though quality products may cost more, they ensure safety and efficacy. Always verify third-party testing and community reviews before purchasing. Proper handling of BPC 157 is crucial for its stability. Reconstitute the lyophilized powder with bacteriostatic water, injecting slowly down the vial wall. Swirl gently to dissolve. Store at 36 to 46 degree off, away from light, and use within 4 to 6 weeks. Maintain hygiene by using fresh alcohol swabs and never reusing syringes. Proper injection technique is crucial for BPC 157's effectiveness. Subcutaneous injections, ideal for general healing, involve pinching skin and injecting at a 45-degree angle. Intramuscular injections, suitable for muscle injuries, require a 90-degree angle into the muscle. Avoid injecting into tendons or inflamed areas to prevent complications. Integrating BPC 157 into a comprehensive recovery plan enhances its effectiveness. Prioritize protein, vitamin C, zinc, and copper for collagen synthesis. Anti-inflammatory foods like fatty fish and turmeric reduce inflammation. Gradually introduce exercise, starting with isometric contractions. Ensure 7 to 9 hours of quality sleep for optimal tissue repair. Use contrast therapy and compression garments to boost circulation and waste removal. BPC 157 is a powerful recovery tool, yet not suitable for everyone. Consider personal risk, injury severity, and health status. Ideal for chronic injuries, athletes, and those with medical oversight. Caution for those with health conditions or cancer history. Quality sourcing and protocol adherence are crucial for safety and effectiveness.